Hi guys, Dr. Anderson here, and I'm with Carmen today, and I'm really excited to share her story. There are a lot of things I could teach with her, I guess. So she's interesting, been great to work with, but she came to me primarily with restless legs. She has restless legs, she has neuropathy, and she has had some back pain and like sciatic pain. So she had surgical decompression of nerve tunnels in her legs, and we'll get into that in a minute. But she's about 3 weeks out on one leg, 4 weeks out on the other leg. And so how's this helped your back? You said something like maybe 90% better?
It's 95%.
Maybe 95%, but hard time sleeping at night,
I
right?
could not sleep on one side for more than 5 minutes. It was constant. That's why I've also been diagnosed with sleep apnea.
Sleep apnea, but sleeping better now. You can tell.
Absolutely.
You don't have to worry about position at night. And she is diabetic, by the way. So, so you'd say she has diabetic neuropathy and also restless legs, maybe secondary to the diabetes. So from the knee up and into the back, maybe 95% better. And then between the knee and the ankle, she's what, 80, 90% better with restless legs?
Mm-hmm.
So the restless leg symptoms at night, you can sleep better?
Much better.
Much better? Okay.
Mm-hmm.
And then down here on the feet, she still has some of the neuropathy symptoms, the burning, tingling, numbness. Maybe not quite as much improved there, maybe.
Much. Mm-hmm.
What would you say, 50, 60?
I would say 60.
Maybe 60% better here. And so that happens sometimes because the same tunnels that we open up here in the leg for restless legs, those nerves travel down to the feet, right?
Okay.
So the idea, folks, is when you have diabetes, you get nerve entrapment because the nerves swell because there's a sugar molecule in the nerve called sorbitol. High sugar levels make that sugar molecule be created by a different biochemical pathway, which is a whole other lecture. But that sugar getting into the nerve makes the nerve swell. So diabetics are a little bit more prone to getting things like carpal tunnel, or in the legs here, entrapment of nerve tunnels. So if I can kind of point around here, I'm going to point to these various nerve tunnels. This is common peroneal nerve. That's one of the main nerves that comes off the sciatic nerve. It supplies the top of the foot. The other nerve branch is here, superficial peroneal nerve. That was opened. And if we can show you on this side, that's the soleal sling nerve tunnel. There's a tunnel right back here directly on the back of the calf that supplies the bottom of the foot. So when we do surgery for restless legs and or neuropathy, we open up all these tunnels. Now you might scratch your head and wonder, well, how can they help her up here? The theory of this is called double crush theory. The idea is, especially when we open up the common peroneal nerve, this is a branch of the sciatic nerve. And so if Carmen already has pre-existing compression in her back, maybe a doctor did an MRI and maybe they can see that there's pressure on the nerves as they come off the spinal cord. Well, that's a site of compression. But before we did surgery, from our examination, we knew that this tunnel was also tight. So there's compression here. Double crush theory says this: if we open up this tunnel and get rid of the pressure here, there's still going to be pressure up here. If you did an MRI, whatever, you could see it. But the nerve is happier because it's all one big connection. By getting rid of the pressure here, there's still pressure here, but the nerve isn't as sensitive to the compression. And that's how, by opening up this nerve tunnel, we have many patients that we see not only are getting help with their restless legs and neuropathy down here, but it's also in their back. So you're getting like 3 for 1.
Thank you so much. I
a lot of improvement.
Thank you.
Which is very awesome. And I know you were very tentative about this.
Yeah.
Kind of going into it, weren't you?
I was, because the alternative is the pill, but that has 20 side effects and no relief.
Very good.
So thank you.
Anything else you want to say real quick? Or,
I'm thankful to God that I have are in my path, and you guys, all of you are wonderful. Your surgery staff, your office staff, your assistant. Thank you.
Especially the videographer.
Absolutely.
The camera, right?
Absolutely.
Anyway, thank you for sharing. I just want to take some time because this is something that hopefully it's going to continue to benefit her usually. Well, and if you want to know about this stuff, folks, please so help others know about this. It's really important. That's why I get on here. The message needs to get out there that yes, restless legs is reversible. Yes, neuropathy is reversible. And yes, maybe you don't have to have a back surgery to help things up here. We can sometimes help if we approach things from the knee down. So thank you for watching. Please subscribe to our YouTube channel. We really appreciate we're growing by quite a bit every month. and we want you to subscribe and share this information for other people that want to get off the drugs or don't want to go down the drug pathway, because that's what a lot of this is. It's a treatment based upon putting you on medication, and that's what we're trying to fight the good battle and make sure people know that that's not the only option. You have this option available to you. So thank you for watching.